Hi, I'm Madison, and this is going to be my presentation on the endocrine system review stuff. My birthday is in November, so I had to do diseases. Um, so yeah, here's my notes, and um, here's my diagram that I'll refer back to a few times. And sorry, I have so many papers on my desk. And here's a word search at the end. Okay, so endocrine system diseases. The first disease I'm going to talk about is type 1 diabetes. Type 1 diabetes occurs when the pancreas can't produce enough insulin, because insulin goes in your bloodstream and it regulates the amount of carbohydrates and sugar in your blood. So if your body isn't making enough insulin, your blood sugar gets all wacky and it goes up and it goes down and it's just crazy. We probably all know somebody who has type 1 diabetes. People usually have it their whole lives, and it's different than type 2 diabetes, which is usually developed later in life. So yeah, people with type 1 diabetes are treated with an insulin pump, and they often have to do blood tests to make sure that like their blood sugar is like at a healthy level. And then just a side note, type 2 diabetes is when your blood doesn't respond well to insulin. Like your pancreas produces it, but your blood doesn't respond well to it, and it's especially common in people with problems with obesity, but it's not just problems for people who are obese. It happens to a lot of people, especially as they get older. The next endocrine system disease I'm going to talk about is growth disorders, and that is basically when the body doesn't produce, or well, the body will produce too much growth hormone or too little growth hormone, and it kind of works respectively. If it produces too much growth hormone, you're going to grow too much. So that's people who are really, really tall, like the tallest man in the world, whose name I forget, but he was like 8'11" or something like that. So he was really, really tall. Or somebody won't grow enough and they'll be really short. And so, yeah, and when someone's too short, it's called growth hormone deficiency, GHD. Or if someone's too tall and they have too much growth hormones, it's called gigantism or acromegaly. The next endocrine system disease I'm going to talk about is osteoporosis, which we kind of learned about back in the skeletal system unit, but it has to sort of do with the endocrine system because it often occurs in women after menopause, so they have lower estrogen levels, which causes their bones to become fragile. The next one I'm going to talk about is polycystic ovary syndrome. And it's fairly common in women ages 15 through 45. Women with this condition can have multiple cysts on their ovaries, and these cysts can often contain eggs, and some of the symptoms include irregular menstruation, increased hair growth, acne, and signs of infertility. So it's kind of serious, and they can also suffer problems like dealing with their metabolism or diabetes. Sorry, I've had a cold. The next one I'm going to talk about is Cushing syndrome. And this is an overabundance of cortisol in the blood for a long time. If you have an overabundance of cortisol in the blood for a short time, probably won't have the symptoms of Cushing syndrome. Cortisol, just a side note, it burns fat and maintains the immune system, and it also responds to stress. So when you have too much, some of your symptoms can be weakness, loss of muscle mass, weight gain due to a slower metabolism. Your skin will bruise really easily. You'll lose your sex drive, depression, and mental fogginess. There's two types of Cushing syndrome. Exogenous Cushing syndrome is a side effect of when someone's taking a cortisol medication, and it will stop once you stop taking the medication. And then endogenous Cushing syndrome It's pretty rare, but it's like it usually happens when there's a tumor on the adrenal or pituitary glands. I'm 3 more diseases to talk about. Next one is Addison's disease, which is pretty rare, but it's an important one. It's also known as primary adrenal insufficiency, and it's when the adrenal glands don't make enough steroid hormones, even though they're able to secrete them. So, like, your body and everything is ready to release the steroid hormones, but they're not there because the adrenal glands aren't making them. So if they're secreted properly, the hormones would regulate blood sugar, boost the immune system, respond to stress, and maintain a healthy sex drive. But symptoms of Addison's disease include fatigue and weakness, no appetite, pain, especially in the muscles and joints, digestive issues, dark spots on the skin, low blood pressure, and a constant desire for salt. I guess because there's not enough salt in the system. And then hyperthyroidism is the next one I'm going to talk about. And it's most common in young adult to middle-aged women, but it also can happen in men. It's just more common in women. And basically what happens with hyperthyroidism usually is antibodies are attacking the thyroid, making the thyroid go crazy and secrete all sorts of hormones. And it can be hereditary. Some of the symptoms include weakness, shaking, like you're really shaky and jittery, nervousness, jumpiness, a quickened heartbeat, fatigue, and rapid weight loss. Also, digestive problems, anxiety, seating, trouble sweating, trouble seeing, and infertility. It can be treated by medication, sometimes surgery, and also radioactive iodine treatments. The last one I'm going to talk about is hypothyroidism. When the thyroid is underactive, it causes a hormone deficiency. The symptoms include fatigue, depression, feeling cold, weight gain, dry skin, low blood pressure, slowed heart rate, and it can be hereditary. So it can be really dangerous because everything is slowed down and your body isn't getting the hormones it needs. Treatment is pretty basic though. It usually doesn't involve like crazy surgeries or treatments. It's just you have to kind of supplement the hormones that the body is missing. So you're usually just going to fulfill the needs that the body has for certain hormones, and it should improve. And just for reference, the thyroid is up here by the throat. You can see right there, thyroid. Right there, it's the thyroid. I'm not good at this reverse webcam thing. That is the thyroid, and so that's where you have problems with like hyperthyroid and hyperthyroidism and hypothyroidism. And then the adrenal glands for where Addison's syndrome happens is around in here, and the growth disorder thing will happen in the pituitary gland, which is up here. And and then type 1 diabetes will happen in the pancreas, which is here, kind of behind where the stomach and the intestines are. So, basically adrenal glands are on top of the kidneys, pancreas is stomach, behind the stomach, the thyroid is up here, and your pituitary gland is in the throat, like not in the throat, but around that area. And did I say pituitary? I meant the thyroid gland is near the throat, and then the pituitary gland is up in the brain, as well as the hypothalamus. And so that was my presentation about diseases of the endocrine system, and thanks for watching. Bye.